Welcome to the Cyber Business Podcast, where we feature top founders and entrepreneurs and share their inspiring stories. Now, let's get started with the show.
Matthew Connor here, host of the Cyber Business Podcast, where we feature successful business leaders, authors, top law firms, green energy companies, and more. I hope you're ready for another great episode in our CIO series, because today we're joined by a former U.S. Navy surface warfare officer who's made his way to being the current CIO of Dayton Children's Hospital, Mr. J.D. Whitlock. J.D., welcome to the show.
Thanks, Matthew. Happy to be here.
Glad to have you. Before we get too far in, a quick word from our sponsors. This episode is brought to you by cyberlinks.com. That's cyberlynx.com. Do you know if a hacker's in your system? Most people and most companies don't until it's too late and the hacker's already done damage. A hacker's job is to bypass your security, so companies need a way of knowing when someone's gotten past their security. That's where CyberLink's intrusion detection comes in. With our 24/7 security operations center, we use a combination of AI and cybersecurity technicians to see when a hacker has successfully bypassed your security. So if a bad guy gets past your security, we'll know right away and be able to kick them out. Find out more at cyberlinks.com. That's cyberlynx.com. And now back to our show. JD, thanks for coming on again. And for those who aren't familiar, can you tell us about Dayton Children's Hospital and your role there as CIO?
Sure thing. So I've been blessed to be the CIO at Dayton Children's for the last 6 years. It's a great job. As our chief medical officer says, if you can't get behind the mission of a children's hospital, then you must not have much of a heart. So I really enjoy being in nonprofit healthcare. Previously, I was with a larger health system, and it's just a great organization. We're on the one of the smaller children's hospitals. We are, as frequently comes up, we're a small health system, but we're not a small organization. So our revenue is about $750 million. 4,200 employees. So, for example, from a cybersecurity perspective, that is not a small organization.
Yeah, exactly.
But compared to a lot of other health systems that we have to keep up with in terms of all the applications that we offer and all the IT and informatics capabilities that we have to enable for our providers, for our nurses, for all our caregivers, and for our patients, we have to do a whole lot of things with comparatively fewer resources than larger health systems. That's the challenge part of the job.
100%. And correct me if I'm wrong, but with those nonprofit healthcare systems like Dayton Children's, a lot of that money is from donors, right? That keep things keep the doors open, the lights on, right? Is that the same for you guys, or how's that?
It is not. Yeah. So nonprofit health systems. First of all, you can have like nonprofit health systems that have 50 hospitals and they're like $20 billion companies. And no, that does not come all from donors. The vast majority of that comes from the way that doctors and hospitals normally get paid by a billionaire insurance company or the government. Typically, there is a foundation, and typically, foundations raise money to do that one extra thing the next thing that we have to do that's the right thing for the patients. What's going on in pediatrics these days, and really across the country, I guess more than across the country, is unfortunately epidemic of adolescent behavioral health issues. And it's like we literally can't build capability fast enough for that. We at Dayton Children's are halfway through building a new building that will do just behavioral health.
Wow.
Like that's how big an issue it is. So that one of the things that our foundation has been focused on recently, as they're raising money, when you're asking people for money, sort of have to tell them why you're asking them for money, and
it helps.
That's been part of it recently. Is help us serve the community by bringing some of the new tools and the new providers and things that the programs that we have to have in place to do that we might not be able to do that in the same way if we didn't have some charitable money coming in. But the vast majority of that revenue is coming
Is
from
insurance.
normal healthcare services and billing for that.
That's great. I know that there are some, children's hospitals, especially that are, a lot of that isn't covered by insurance, and those end up being, they take huge losses on a lot of their procedures, a lot of their kind of even departments, and they kind of specialize in it might be burns, whatever it might be, or some cancers, and so they end up being, wildly unprofitable, and that gets, kind of covered by all the charitable donations. Which I think makes for an even more challenging job for, I mean, it's hard in healthcare to begin with because the insurance company, and again, correct me if I'm wrong, but the insurance companies are, really put the screws to the providers, if you will, to the healthcare system to, and that really regulates, since all of your revenue, really, the vast majority of it comes from the insurance agency, right? Then you're working on small margins to pay for everything, and then when you have, cybersecurity needs kind of, working to get that very finite budget. I mean, another $4 or $5 billion company might be wildly profitable and have plenty of meat on the bone to fund any sort of cybersecurity need without it being an issue. But I think for healthcare in particular, and I think this is going to be a really interesting topic for a lot of other CIOs, and they live it every day. But I think for a lot of people, realizing kind of the pressures and struggles of a modern, healthcare system when it comes to their budgeting and security and IT. How do you deal with that? Any, besides, the struggle is real, you know,
Yeah.
How are there any tips, tricks, or it's just a brutal slog and you gotta do what you can do?
Yeah, so everything you just described is actually accurate. One thing I'd add to that to give a little bit of color to that is health systems generally after the pandemic. What happened with the pandemic, or in the early days of the pandemic, it's all hands on deck, and of course we don't we don't need to talk about that. That's been the topic of lots and lots and lots of previous discussions and podcasts. But the sort of the hangover from that for health systems is that the cost of labor has gone up. A lot of folks were said, okay, I'm done. I'm out of here. I'm retiring. Maybe a couple years early after all that, and good old supply and demand, and so labor costs have gone up, and the revenue did not go up. So yeah, a lot of health systems have been really struggling just to break even. So how does that factor into cyber? That absolutely is a critical thing, in particular for a lot of smaller and rural health systems. That yeah, if you literally are in if you're literally losing money, it's a little difficult to justify spending more money on cybersecurity. Specifically at Dayton Children's, we have good leadership, smart leadership, good board. We go and we say we need these resources to do the responsible thing with cybersecurity, and then we typically get those resources. So managed detection and response vendor, like you all do. We that was a couple years ago. We started with that. We said, hey, this is something we're really should be doing or not, and are not doing effectively, and then the money was provided for that. So
That's great.
obviously you never want to sit around and brag about your cybersecurity
Of course.
program in a public way. So I'm not going to do that.
No,
But
no,
we have the basics in place. And when you hear about other health systems specifically, obviously everyone's getting hacked for all sorts of reasons. Uh, the really worst case ransomware scenario, no kidding, you're down for a month. Your electronic health record is down. Your doctors and nurses are back to paper. It usually comes down to the bad guys getting into the back end of the crown jewels, right? And
yeah,
your privileged access into systems. And so how do we implement defense in depth and zero trust and make sure we're MFAing everything all the time. All the basics, the blocking and tackling things that we need to be doing. And so our leadership has made sure that the money is available for those things.
And that's great. And I think that, speaks to, as you said, the leadership being there and recognizing that. It's really sad that, hospitals are such targets, right? And I think they got targeted early on when people were like, surely they're not going to be ransoming hospitals where people can die. And then they do, and people die. And that's just, it's one thing to go after a business, and it's disruptive, it's costly. Worst case scenario, people might lose their jobs. Okay, it's a financial hit. It's another when it's human life is, is the cost of that. And that is unscrupulous, to say the least. It's horrible, right? And the fact that there are people out there doing it. I think one of the things I really loved, it took me a long time to realize it, was when I switched over from the Army. One of the things I loved about the Army was kind of the mission that we had, right? Kind of defending the nation, even when you weren't deployed anywhere, you weren't doing anything. Just the presence, was enough. And it being, having our military presence, is a deterrent. And so I love that mission. And it took me a long time to realize that one of the things I loved about Cyberlinks was we're doing that. We've extended that. Now we're helping defend, U.S. businesses from these attackers. And it wasn't really as prevalent and obvious, I guess, until it became a very obvious and and directed attack at U.S. businesses. And so now it's a new mission, right? It is defending our nation's businesses, our healthcare systems. And, how do you not get behind that? Like you said, if you don't have the heart to, help children, if you don't really, right? So I think that's such a great thing that you guys are doing there. And then you get the added bonus of kind of defending that whole organization. Is that something that you find as kind of a mission that kind of bonds the entire, IT staff? Is that something that they just kind of naturally get behind because every day you're fighting that? Or is it something that you lose track of and you just don't think about?
Sure. Well, when you consider the IT department at Dayton Children, so it's 140 people. One thing that's significantly different, if somebody doesn't work in healthcare, might not really appreciate what this looks like. That is about half and half between what most people, if you know IT, you would think of as a regular IT department with infrastructure and operations and service desk and sysadmin and PMO and cybersecurity, ERP, those kinds of things. And then the other half are people that are configuring our electronic health record. And if that sounds like a lot of people that are configuring electronic health record, it is, but that's what it takes to keep but that's our operating system, right?
Yep.
And it's our clinical operating system, and really it's also most of our financial operating system. Going back to all the insurance company stuff, which we don't really, I don't think we want to go down a rabbit hole on healthcare revenue cycle, but it's elaborately complex how you have to actually get paid by the insurance companies, right? Patient comes to the hospital. We have to have coders and billers, and we submit the bill, and then this gets denied, and we have to have denial analytics to figure out which of those claims we might actually still get paid on if we spend more work on it, as opposed to spending more work on it and still not getting paid anyways. It's crazy complex. And then there's also all the appointment stuff that goes on there, and how do we make sure that we're being very patient family friendly, because we're pediatrics, right? So really mostly it's mom and dad, in terms of scheduling the appointment online, all those kinds of things. So really half the team is doing all of that stuff. So
Wow.
how much are obviously the cybersecurity team, a small chunk of that, the cybersecurity team, they spend all day thinking about that. What percentage of time does everybody else think about that? Much, much smaller time. We do monthly all hands meetings.
Mhm.
And so we are frequently talking about some cybersecurity topic, in particular, how incredibly important it is that particularly for the folks that have the elevated privileges into things,
Yeah.
right? How do we do phishing awareness campaigns
Hmm.
for folks that are in positions that and their education level and their reading comprehension level were like maybe testing the bounds of what they're even capable of understanding with some of the subtleties because, oh, you know, we did the fake phishing exercise and now you failed and now you have to do the mandatory education. And here's why you failed. Not everybody can even really understand why they failed. Wait, what was they supposed to do
Yep.
differently? We have higher expectations for folks in IT. We have really high expectations for the subset of the folks in IT that actually have the keys to the kingdom.
Yeah.
Right. And so those privilege access credentials, which of course are different than the regular credentials and should be in privilege access management and all that stuff that we need to be doing to be responsible, right? So I guess that was a long-winded way of, of saying that yes, everybody really ought to care about this. In IT, there's an elevated expectation, but really within IT, it's a subset of people with elevated credentials.
Well, actually, I love that you kind of, I guess focus your phishing training on the IT section, department.
No, I'm
And then
sorry. I didn't mean that. If I said that, I didn't mean that. We
okay,
focus
for
it on
everybody.
everybody equally.
And then the people with
I'm
privilege access, they're the subset that gets extra, attention, the more difficult and challenging ones,
Yes.
right?
What we do is when we look at who failed the phishing, and we do monthly fake phishing, we
Mhm.
look at who failed, and the people that really shouldn't fail, we spend
Yeah,
a little extra time with them
that-
sometimes.
that's great. And now let me ask you, do you guys do that internally, or is that like a kind of a system where they then go through the video training and that, or is it a combination?
Yeah, we use Know Before, which is I think
No,
sort of 800 pound
yep,
gorilla out
yeah,
there. I was looking at Gartner recently. I think there's we started that 5 years ago with sort of like the go-to vendor,
yep,
and
they're great.
there's some other really good ones. That's not a hard recommendation for them. There's some other really good ones out there now.
Yeah, 100%. No, that's really cool. Yeah, and everybody really needs to. It's surprising how many organizations don't do that,
Mhm.
and it's like it doesn't, and they take comfort in knowing, oh, we've got, and let's say they've got intrusion detection. That's great, but if everybody's constantly, you let's say you've got the best alarm system in the world, but the kids keep opening the door and letting the plumber in. Well, nobody called the plumber. Why you keep letting these people in? Not gonna kick them out, right? And eventually, that's just it's a recipe for disaster. So if
Yeah.
we can make sure that they're only letting in the right people into the house, so much better than just open door policy.
Where you want to be with culturally is when you go to send out the stuff that you really need people to do, like the employee engagement survey. You have to tell people 5 times, no, this is for reals now because
Because
everybody's
now they're
so
ignoring
worried about the
everything.
fake phishing.
Yeah.
Yeah.
That's funny. Yeah, I guess that is the downside, right? They get so prone to just nope, I'm not touching it, that they don't touch the stuff that they're supposed to touch.
Right.
So that is the downside to that. Well, let me ask you, because you, on top of your CIO roles, you also do some consulting, don't you?
I do a little consulting after hours. I find that it makes me better at my day job as Dayton Children CIO because I'm spending time after hours that I would otherwise be doing something else, really learning more about the industry. So yeah, I work with some of these companies that do it's basically like matchmaking between like a I don't know, it's like an investment research or they want to some software vendor is raising money or wanting to do an IPO or something. They want to talk to people that actually use the software after they get the pitch deck from
Nice.
they want to talk to people that actually use the software. And so, I'll talk to them or I'll talk to some healthcare IT companies that have a great product, but they don't, but they selling into health systems is hard. Um, and understanding the evaluation process and the decision making and how all that stuff works. So that helps them uh, folks with that. So that's kind of fun.
Oh, that's fantastic. I mean, honestly, it is really hard. In fact, for the longest time, we said, you know what, we're just going to avoid, healthcare systems altogether because it's so challenging. I mean, in a lot of ways, I think it's easier to sell to the government than it is to sell to healthcare systems. And so I think that's a really valuable, resource and service to be offering people because when you're focused on that, you have a good mission. You're really trying to do some good and help kind of society as a whole. When you're working with healthcare, getting in there can be incredibly challenging, so having those resources, I think, super valuable.
It is challenging. It's also almost a fifth of the economy. So it's
Wow.
rewarding to get into it. If you have a service that healthcare really needs and you know how to sell into it, then it's a good place to be. So
Wow. So do you what's your kind of target, audience there, or your kind of sweet spot client for consulting?
Yeah, so health tech, digital health companies that have a really good idea, that but are just struggling to get awareness for their product or service, or like research and consulting people that just want some ongoing help with basically my pitch is because I'm a practicing health system CIO, I can sort of, relay the reality on the ground in the trenches, whatever, for the folks that want to understand how decisions get made.
Yeah, no, that's fantastic. Well, you can't like walk them into your you know into your hospital per se. It's great to be able to give them the kind of that insider's insight into if they were pitching someone like you, how do they go about it? How do they get to that position?
Yes,
That's
precisely.
fantastic.
Yeah.
I love that. All right. So, well, before we get off that topic, what is it? It's Wits End Consulting, right?
Wits End Consulting. So I'm the only son of an only son of an only son, and I have two daughters. So Whitlock ends with me. So Wits End, that's where that came from.
Oh, cute. Not because you were at your wits end or because people
Because
get
I'm
to their
at,
wits end
yes,
and then hire
yes,
you.
that's right. If you
That's
hire
right.
me, I'll not be at your wits end.
There you go. That's fantastic. And where can somebody find you there? What's the best place?
Witsend.tech, WHIT, witsend.tech.
All right. Well, we'll put a link to that because I think that
Yeah,
that's
very good.
fantastic. Okay. So moving on from consulting, and I often like to ask, especially people who've kind of come up from a uh, you know kind of the non-traditional, what you might consider a non-traditional path, which I'm beginning to realize I don't think there is a traditional path
Right,
in IT.
right.
I'm not sure that it exists. I don't think it ever really has, just because it's so new and it's so varied. But can you tell us a little bit about your background? Because I think that helps people see that you don't necessarily have to start out and kind of live and breathe IT from day one,
Right.
to get there. So can you run us through your
Sure.
past?
Yeah. So I'm retired military. We talked about that a little bit up front with the Navy. 7 years Navy surface warfare officer, driving ships around. I did desert. I was launching Tomahawk missiles from my destroyer and Desert Storm back in 1990 and or 91, I guess. And so that was military stuff, not healthcare stuff. 7 years of that. And then I decided that that was fun, but I didn't want to do that forever. I got a master's degree in healthcare administration, actually a master's in public health. And then I realized that, hey, military needs healthcare administrators too. I'm a third of the way into a military career, might as well finish it off. And so then I wound up actually switching over to the Air Force. Long, boring story, not worth telling why I switched from the Navy to the Air Force, but I did. And then I did some operational roles in healthcare management before I got into healthcare IT management, and which comes in very helpful because I really understand healthcare operations, maybe more than somebody that came up purely through the IT side, um, and maybe have a good understanding of how to talk to our clinical leadership about things, and relate that to all the technology, right? Um, so what was very nice about working in the military health system is that the population health management stuff about how do we take good care of a population of patients and keep them healthy and out of the hospital, as opposed to wanting to do more things to them and poke them and cut them open and take things out, to make more money. That's the mission of the military health system, and the private sector healthcare system struggles with that sometimes because there are incentives put in place by the government and Medicare and all that to try to do that accountable care stuff, but it's challenging. So anyways, got to 20 years, retired from the military, and then started out on the private sector side. We were talking about nonprofit healthcare a little bit. One thing I really like about nonprofit healthcare is it still has that strong mission focus, like you were talking about. But at the end of the day, you still have to not lose money. As we like to say, no margin, no mission in nonprofit healthcare. And so I do appreciate, though I had a wonderful time in the military. I finished up last 5 years in DC, like a lot of people do in the military. And let me tell you, the bureaucracy and the wasting of taxpayer dollars, and that was a little frustrating. So now it's nice to be in a business that still has to make money, not lose money, but it's still very mission focused. So to me, that's sort of like the sweet spot where you still get the mission focus, but it's a business. So I appreciate that.
Yeah. No, 100%. I think that's just it always, strikes me as I don't know. It's such a stark difference between being in the government at all and kind of seeing the bureaucracy, and I don't want to say waste because that sounds, it's just not as efficient. And when you get to the business side and there's a mission and you got to be efficient, and and I think a lot of people take that the wrong way and think of it in some sort of negative way, that it's like it's all about money. And I think that gets twisted and contorted into something that it's not. I think that, just like your own personal budget, if you're not, using your resources wisely, you're going to run into problems, whether it's your personally, your business, your government. And I think just having that kind of financial accountability to the things that you're doing, just kind of forces the responsibility. And when you tie it back to a mission, right, I think that gives people real purpose. It's not, and it's so obvious in your job because your mission is to help kids. I mean, it's hard to have a better mission than that, right? But even when it's not, when it's I don't know, let's say you're making some widget, right? Doesn't matter. If nothing else, you're providing a way of life for everybody in that organization. And if since they're spending a third of their life in that job, right, working, then wouldn't it be great, and shouldn't it be great, that that's a really good environment where they're doing something good, they feel good about what they're doing, and then when they get home, they're not kicking the dog and yelling at people. They feel good, they've had a good day, they've done something, even if it's just to keep everybody else afloat, right? And so I think that, tying it to the mission, and I wish there were a way in the military and in the government to make it more kind of, but I don't know if that there is. It may just be one of these things where it's inherent in that system. It's hard to make it, as accountable and as efficient. I don't know, but it is nice to be on this side of it and be able to live that kind of life where you're doing good, you're making money, you're providing, this kind of great service to people. So my hat's off to you. I think that's, it's so admirable what you guys are doing. And, I just wish we also had a way of, I know the bad guys are using AI. And so, we use AI to defend. I just wish there was a way to ensure that we, it wasn't just a level playing field, but that the advantage was purely on our side, and be a kind of uneven fight, an unfair fight against the bad guys if we could. And I don't think we're there yet. But as they started using AI, I think the battle got tougher, right? And so for you guys, it's a real everyday battle that where lives are actually affected. Whereas for everybody else, that might be reputation, it might be money, but for you guys, it's a real. right? And so I guess before we go, is there any kind of advice you give to people? How do you deal with that? Is it a stressor that, day to day, it's like, lives are on the line. If we fail, somebody could get actually hurt because, we didn't keep it safe? Or is it you're so focused on the mission that you don't really have time for that? How's that work when you're in the trenches there?
Sure. Well, the cybersecurity risks are very real for all the reasons we talked about before. And so we have to have good downtime procedures. We have to exercise those. Bad things can happen both because of cyber problems or of other problems, natural disasters.
Good point.
We are now apparently in Tornado Alley. We've never been safe for tornadoes where we are in southwest Ohio, but apparently due to some of the global warming patterns or something, we are now officially in Tornado Alley. So
Congratulations.
a couple of years ago, we had a F4 tornado miss our main campus by a mile, and so commercial power was cut off for about a day. And then after the UPS batteries that power the internet pipes died, internet went out, and our primary and secondary campus are where our two data centers are connected with dedicated dual redundant dedicated fiber. So as long as we have diesel to put in our generators, we can keep delivering care there safely, even when we are cut off from the outside world, which is part of the reason we will keep our core clinicals on premise for a while. So those things that's absolutely always on my mind. Now, whether it's a ransomware attack or whether it's a tornado or whether it's some dumb thing happened in the data center and the fire suppression thing goes off and takes out one of our data centers and we have to, no kidding, fail over to our secondary data center and storage and all that stuff. Of course, that is always anxiety producing. And what is the right amount of resources to put into that stuff versus what is the right amount of resources to put into making sure that everything stays optimized so that we're delivering better care to our patients and a better user experience to our doctors and nurses and other clinicians.
Well, my hat's off to you. You guys are, you're doing great work there. And, I know it's every day is a challenge. And I love that you guys seem to handle it with such grace, right? So despite the tornadoes, the cyber threats, the everything, you take it all in stride. So I'd like to thank you for that and continued success on what you're doing there. And before we go, though, can you tell everybody where they can find out more about you? And once again, your consulting and Dayton's Children.
Sure. Dayton Children's, it's childrensdayton.org. And you can find me easily on LinkedIn. I'm the only JD Whitlock on LinkedIn. There is another JD Whitlock, a young man plays high school football in Alabama, but he's not on LinkedIn. So only JD Whitlock on LinkedIn, I think. So yeah, hit me up there.
Love it. Awesome. JD, thanks so much for coming on today.
Thanks, Matthew. Great chatting with you.
You too.
Thanks for listening to the Cyber Business Podcast. We'll see you again next time, and be sure to click subscribe to get future episodes.